Good afternoon, and thank you for joining our webinar today entitled Keeping Kids Out of Isolation and Engaged During COVID. My name is Michael Umpierre, and I am the director of the Center for Juvenile Justice Reform at Georgetown University's McCord School of Public Policy. We and our partners at the Stop Solitary for Kids campaign, including the Center for Children's Law and Policy, Justice Policy Institute, and Council of Juvenile Justice Administrators, are delighted to be hosting this webinar today on such an important and timely topic. As you may know, the Stop Solitary for Kids campaign is dedicated to ending the practice of solitary confinement of young people in juvenile and adult facilities throughout the United States. Through the campaign, we and our partners at CCLP, JPI, and CJJA work to increase public awareness of the harms of solitary confinement and to assist leaders and jurisdictions all across the country to amend policies, practices, and approaches to support young people in detention and commitment facilities and other facilities without using solitary confinement, otherwise known as isolation, seclusion, segregation, and room confinement. For those of you interested in learning more about the campaign, I encourage you to visit our website at stopsolitaryforkids.org and to contact us directly. Again, we'll post that URL as well as the contact information for the campaign manager, Jenny Lutz, attorney at the Center for Children's Law and Policy. In addition, at the conclusion of this webinar, I will be sharing some very exciting news about new resources and new training and technical assistance opportunities for the field in 2021 and beyond, courtesy of generous support from our wonderful partners at Arnold Ventures. So please stay tuned for the conclusion of the webinar for that announcement. As you know, we're here today to talk about how we can best support young people who are currently placed in detention and commitment facilities during the COVID-19 pandemic without resorting to isolation or room confinement. It goes without saying that this public health crisis has been challenging on so many fronts for young people and families, but also for juvenile justice practitioners and partners who work at the facility level and who've been grappling with how to best keep young people and staff safe and healthy while also keeping young people engaged in the type of programming, education, treatment, health services that we know is so critical. Unfortunately, this pandemic has not spared youth and staff in facilities. According to data collected by the Sentencing Project, as of last week, there were 3,360 reported cases of young people placed in juvenile facilities nationally who have tested positive for COVID throughout the course of the pandemic, and more than 5,000 facility staff who've tested positive as well. And with the current trajectory of our rates nationally, many expect these numbers, unfortunately, to continue to rise in the weeks and months to come. So given these realities, several questions arise as to how juvenile facilities should be operating. How exactly can facility staff keep kids safe and supported in the face of this crisis without resorting to a practice like isolation? How do facilities provide that vibrant education and programming and treatment to young people? And how do we maintain kids' connections to families and to community supports during this extraordinarily difficult time? These are some of the questions we hope to explore today with our three terrific panelists, each of whom represents an agency that is taking concrete steps to reduce the use of room confinement in the facilities that they operate. We're joined today by truly a cross-country panel of leaders, including Brett Peterson, Director of the Division of Juvenile Justice Services within the Utah Department of Human Services, Deidre Bridgeforth, Assistant Chief of Juvenile Detention Services in Jail East at the Shelby County Sheriff's Office in Shelby County, Tennessee, and Mac McGee, Chief of Secure Programs at the Department of Youth Rehabilitation Services here in the nation's capital, Washington, D.C. In just a minute, Brett, Deidre, and Mac will more fully introduce themselves and provide more background on their agencies and the facilities that they operate. But before we do that, let me briefly cover some housekeeping items for our webinar audience today. First, we will be hosting a Q&A period towards the conclusion of the webinar. While we won't be opening up the phone lines for your questions, we will be taking those questions in writing via the questions box on your screen. We'll do our best to answer as many questions as possible, so keep those questions coming as you hear the panelists speak. Second, feel free to chat with your colleagues using the chat box on your screen, separate and apart from the questions box. We find that it's always incredibly valuable when webinar attendees share their own insight, provide links to resources, and learn from one another. And given that we have hundreds of participants with us today, I know we've got a remarkable depth of experience and expertise to tap into. And finally, please know that we are recording today's session. We will be sharing the link to the recording for everybody who was unable to join us today, so stay tuned for that as well. Okay, with that housekeeping out of the way, I'd now like to get the conversation started. And to do that, I'd like each of our panelists now to introduce themselves. And so, Brett, I'm going to start with you. If you could please tell us a little bit about your agency, your role, the types of facilities you operate, and also tell us a little bit about how you approach room confinement in Utah. What is your room confinement policy and what exactly it entails? After Brett, we'll turn to Deidre and then Mac, and then we'll begin to talk a little bit about the impact of the pandemic and your efforts to reduce room confinement over the years. So Brett, I'll start with you.
Thank you, Michael. Great to be here with you guys. Good to see my fellow panelists, and I can't see the rest of you, but I'm really grateful to be here. So I'm Brett Peterson. I'm the Director of Juvenile Justice Services in the state of Utah. So we operate kind of the continuum. We have, early intervention services, and then all the way through to long-term secure facilities. So from a facilities perspective, we operate all of the detentions in Utah, and we also operate all of the long-term secure facilities and settings. From a real high level, kind of thinking about confinement, the kind of nuts and bolts of our policy is that, it's not to be used, it's only a safety and security measure. It's not to be used just for operational convenience. If confinement is engaged for some reason, if a youth is placed in their room, at the real heart of our confinement policy is this need to continue engaging and processing with the youth. It's not somewhere to put them to then move on. There's this ongoing contact and communication. But then I think, as you'll hear from the other panelists, the structure from there is if this does happen, that 15-minute kind of threshold, then you have to have an incident report. It has to start going up the line. If they're there for an hour, or if it's going to be an hour, they have to have permission before they could be there for that kind of extended time period, and just kind of going up the tiers that way. So that's really kind of the heart on a very high level of our confinement policy.
Great, thanks so much, Brett, and we look forward to talking more about the details. Deidre, I'll turn to you to introduce yourself and say a little bit about your role and your facilities and your room confinement approach and policy.
Good afternoon, and thank you for an opportunity to speak on such an important topic. The Shelby County Sheriff's Office is a full-service law enforcement agency. It also operates an adult jail, women's facility, and a juvenile detention center, of which I am the assistant chief of. Our facility is designed for those identified as a danger to the community, to themselves, or a flight risk. Our facility is a 135-bed, single occupancy, secured detention facility. All of our youth participate in a positive behavior management program that emphasizes and accentuates the recognition and reinforcement of positive behavior. And we found that this program aids kids in feeling safe in a safe environment, and when they feel safe, they tend to act out less. Our room confinement policy just consists of what Brett said. Conditions where youth pose immediate danger to themselves and others, and also where less restrictive crisis intervention techniques have failed. Staff must obtain authorization from a captain, chief inspector, and even medical prior to placing a youth in-room confinement. And this is with the goal of using as little amount of time in the room as possible. There's a release assessment strategy that goes in place with staff and the youth. And when the youth successfully, if they're successful in this strategy, release strategy, the youth then returns to the group. So pretty much it's monitored, it has to be authorized, and we just, I mentioned the positive behavior management program because we build an environment that provides a safe environment and a healthy environment for youth to develop, and that tends to lead to them acting out altogether. So it works hand in hand in a sense. Our positive behavior management program, which we do very well in limiting and assisting us in limiting even the use of a child room confinement where a child is acting out. Thank you.
Excellent. Thanks so much, Deidre, for that overview. And let me turn to Mac in Washington, D.C. to hear how DYRS approaches room confinement, a little bit more about the agency and facilities as well.
All right, good afternoon. Thank you, Michael. My name is Mac McGee. I'm the Chief of Secure Programs for the Department of Youth Rehabilitation Services here in Washington, D.C. I have the privilege of overseeing two secure facilities. Our first facility is Youth Service Center, which is an 88-bed juvenile detention facility. It houses our pre-adjudicated youth, as well as our Title 16 population, which is juveniles that are charged as adults, as well as our young ladies. And then the other facility is New Beginnings Youth Development Center, which is actually in Laurel, Maryland, about 15 miles up the road. It's a 60-bed secure treatment facility, and it houses all of our juveniles that are committed here in the District of Columbia. Generally, young people may be here anywhere from 6 months to a year. In terms of our room confinement policy, it mirrors a lot of what has already been said. It's a temporary response. Two young people get into an altercation and they may be put in their room, but as soon as they're ready to process it, either with staff, mental health, a manager, then they're able to return unto the milieu. We have trained restorative justice professionals that work to prepare them for restorative conversations and things like that. And so it's been a very effective policy that we implemented probably almost 3 years ago now.
Excellent. Thanks so much, Mac, for that overview. And I think part of what makes this conversation so interesting is that every jurisdiction, every facility looks different, and the path that you all have taken to get where you're at with respect to your room confinement policy. I know that there's a different story in Tennessee, in Utah, and in DC, so we look forward to unpacking that a little bit. Brett, let me turn to you now that we've kind of got the context of your systems and the facilities you operate. Each of you talked about how you limit the use of room confinement really for very narrow purposes. You talked about how you can use it as a response to an immediate threat to others, but it's very temporary in nature. Really, the goal is to keep kids engaged in programming as much as possible. You prohibit the use of room confinement for disciplinary reasons, for example. Brett, from your perspective, why do you think it's so important to limit room confinement in the ways that you do, and what are some of the benefits that you've seen in Utah from taking this approach at the facility level?
So I think, fundamental to our approach and our commitment to care is that, we're in the business of changing young lives, and in doing that will better our public safety outcomes. So when a youth is in one of our settings, that's kind of the heart of what our, the vision and the why for our staff as well. It's like, look, you're not here to warehouse people. You're not here to be a jailer. You're here to work with these youth, to work with these young people. So especially in my secure care settings, we changed several years ago where my front end kind of counselors, they're the ones delivering, the skill side of dosage, the skill based DPT approaches that we use. And so that kind of continual engagement is critical for kind of the progression and the reduction of risk with those youth. And it doesn't take. I'm definitely not the smartest guy on the block, but you start to see those relationships start to flourish and strengthen as my staff engage and they become that go-to for a youth in a facility. Not only does that youth, his risk starts to go down, and he starts to progress or she starts to progress, but the whole environment is improved. And so, and that can't happen if you're just putting a youth in a room and on you go. I mean, we have our policies, but I've heard my program directors over our secure facilities, I've heard them say basically, they never should be in their room. Like they should never be in the room. And there's times where we know there are situations where that is needed. But really kind of having that at the core, I think is really impactful.
Thanks, Brett. We know that every minute, every second matters when the young person is in the facility, away from their families, away from their communities, and making sure that we're able to maximize that time in programming, in education, in treatment. Those services are so critical. So thanks for providing that. And I want to turn to Mac next, because this notion of keeping kids engaged in programming and education and treatment in this environment in particular with the pandemic, I know has been incredibly challenging for facility staff all around the country. How you operate with the public health guidelines, how you operate, in the face of staffing implications, in the face of folks testing positive. We know it's been very, very challenging. Mac, from your perspective, as we think about this overarching goal of keeping kids engaged at the facility level, what's been the most, the biggest challenge for you in DC at DYRS in the face of this pandemic?
Well, that's an excellent question, Michael. I would say early on in the pandemic, we had to get a handle on everything that was going on, right? We had to become informed, we had to become educated, because of course our goal is to ensure the overall care, welfare, safety, and security of youth and staff. And so it was very important for the managers and the leadership for us to be able to provide, relevant education and knowledge and be able to cascade that down to our direct care staff, showing up at roll calls, our chief medical officer, our deputy director of behavioral health, everybody showing up at roll calls, making sure that we're providing individuals with the information that's going to help to reduce the anxiety levels that people were experiencing and are still experiencing, right? Ensuring that we're operating, following the CDC guidelines, our own DC Health Department, but really following the leadership of Dr. Tyler Bynum, who's our chief medical officer here, making sure that, we had all of the proper PPE, in terms of contact tracing, things of that nature. But what it did was it forced for all of the individuals that are what I will describe as part of our core support team, anybody that has any type of involvement with our young people, from the youth advocate, the YDR, the JJIC, which is our juvenile justice institutional counselor, the treatment manager and team leaders, the care coordinators that work with them when they return to the community, having conversations on how we can modify programs. We've worked very hard with our educational partners to modify that educational experience to ensure that they were still getting education. At YSC, working with DCPS, we have an in-house education team. Mr. Gunthrop is phenomenal, that worked exclusively with DCPS to ensure that our kids had incentives to continue through a virtual setting, as well as education packets, get the education that they needed, as well as our partners at New Beginnings, which is Maya Angelou, showing up, setting up an A/B schedule where some young people would be in the school while others would be receiving education on the units and things of that nature. And so basically, we had to, sort of reframe and approach how we did things differently with respect to social distancing. And Michael, as you know, we have very nice campuses here in the district. And so we're able to try to utilize as much space and spread people around so that we can still have them engaged in education and programming as well as mental health and treatment.
Yeah, thanks so much, Matt, for that description. I know that it's been a balancing act as we navigate, the public safety concerns and the health safety concerns with the need for programming. Let's talk a little bit about intake and admission. I'm going to turn now to Deidre to talk a little bit about that. It's interesting, jurisdictions have taken different approaches to how we handle admission. In fact, we're getting a question here from one of the webinar attendees around this notion of quarantine and how we're handling kids when they first come to the facility. Deidre, I'll start with you. Talk a little bit about how you've handled intake and admission given concerns related to COVID-19, including any efforts that you've taken to ensure that you're not resorting to room confinement as part of this intake process. We'll hear from you, Deidre, and then Brett, I'll turn to you in Utah because I know that you take a slightly different approach based on some technology that you have. But Deidre, I'll start with you.
Yes, Mike. All of our youth are screened in the salad port. Medical goes down to the salad port, and they are screened with a questionnaire, and they have a temperature check. And also, the transporting officer has a temperature check prior to being admitted into the facility. Now, if youth respond yes to the questionnaire or have COVID-related symptoms, we have a COVID preparedness plan that's already in place where we've designated areas where they can be housed to receive medical monitoring. And as far as testing goes, this is ordered by the physician on a case-by-case basis. We also have identified areas in the facility where youth that answer no to the questions, where they are housed. They receive all of their services, all of their programs, meal services in that designated area. Now, they do not receive medical monitoring, but we kind of have housed them there for 14 days and kind of stage them there and not with general population in an effort to identify any type of COVID symptom or related illness in that area, and we can kind of identify it and address it immediately prior to introducing them to general population. So that's just an extra step that we've worked with the health department administrators and directors on, having a plan in place, just an extra step to try to starve and the spread of this virus within our facility, and it has worked. Thank goodness for us by kind of streamlining it that way. As far as quarantines, if a youth were to come in contact with the staff, we do have a protocol where youth come out in an area and they receive their recreation only in that particular area as well. They do have a 14-day symptom check, temperature check, to ensure that the virus is that the virus hasn't affected them in that way. And what we do is we move our youth that are in that area, because we're single occupancy. We move them out first, and we strategically bring this group out to participate in their recreation for the day. Once they return back to their room, there's stringent cleaning, sanitizing in that area, and the other youth that return back only go into their rooms that are sanitized and cleaned daily as well. So we do this strategically in the event that we have a group that's under quarantine, and our ratio is 1:8 during waking hours, staff to youth, and 1:12 during the night hours. So that gives us an opportunity to keep the group small in the event that it does impact a group at a time. So we've been, that has worked for us in being strategic in the way we handle quarantines and things of that nature. And we've been blessed that we have not had, knock on wood, a youth to test positive in our facility since it began.
Thanks, Deidre. And I am seeing a follow-up question, so I'm going to direct it right to you, Deidre, before turning to Brett. But with respect to those kids in the 14-day period where you have them in a designated space in the facility, talk a little bit about how you keep the programming and the education going. If I'm hearing you correctly, that doesn't stop. Those kids are getting the full array of programming, education, treatment services. Do they experience that as a cohort as they go through the 14-day period? Talk a little bit about that, kind of how the experience of the young people throughout those 14 days.
throughout the 14 days, the youth still participate in program activities only in that area. The officer that's assigned to that area and the relief officer, we try to limit the amount of people that go in and out, because at this time we are kind of monitoring the area, but they still participate in physical. We have a full-time recreational coordinator that works with our youth, and we have a full-time programs manager. And one of the things that really aided us in working with the youth during this pandemic is encouraging them to make cards for the essential workers. And they really enjoyed making cards, thanking them for their service, and even thinking a few cards for our community as well. So we got them engaged and involved in this pandemic as well, and not just be idle, but be very constructive in reaching out to other people and letting them know that they're thinking about them. They still have of course, the television. We have a library in that area to keep them engaged and involved. And we have donations from our community, pizzas. I mean, we spoil them really, pizzas and snacks and things of that nature. They still have telephone calls daily. So keeping them involved, the officer keeping them involved, talent shows. It's a lot going on here. But with the program manager and the recreational manager working with us with them during that period, we're able to get them through that period. And there have been times when the doctor has ordered a testing so that they could be released from that period of quarantine sooner. So a lot of things are going into play with working with them and keeping them engaged and getting them safely released from quarantine through testing at times.
Great, thanks so much for that. And let me turn to Brett now. Brett, I understand that you've got rapid tests that you were able to identify in Utah. Talk a little bit about your intake and admission process and how you handle it.
Yeah, so first, I think it's really critical for this type of a conversation, especially on COVID, to think about, for us, a lot of the steps that have helped us navigate and operate during COVID were taken before COVID happened, in the sense of from a policy perspective. So in the last 2 years, my detention admissions are down 50% in just the last 2 years. Today, for the entire state, I have less than 50 youth in detention settings, and so we have more kids in home detention. So that really gave us this opportunity and a platform to operate kind of at an optimal level, even during a pandemic, which has been no fun for anybody. So we really early on in the pandemic, before we had any kind of cases or more community spread, we were able to obtain rapid test machines. And so now the protocol is every youth that's brought in, we ask law enforcement to call ahead if it's, talking about on our detention side of things, and just to give us a notification if the youth has symptoms, just so we can contact trace and map out from there as far as contact. But then right then when a youth's brought into intake, one of those rapid tests are administered. And so they're only kept in that area for, it's 30 minutes essentially, 30 minutes to an hour to get test results. And then as soon as we have that result, then we're able to kind of process and move forward from there. That's really, really been a game changer for us when it comes to detention, and also in our long-term settings as well, being able to have that resource, but especially on the front where, we can't really control who's coming to the door necessarily with law enforcement. So that's been really critical for us.
And Brett, we're getting a question here from a member of the audience who's interested in knowing how those tests are funded. Is that something that your agency covers, or is that through a partnership with some of your colleagues on the health side? How have you been able to cover that?
Yeah. We would have happily paid for them and bought them. We actually were able to get them. The state level Department of Health was able to get, and this was early in the pandemic. They literally had, I remember it was like, they had like 30 for the whole state or something like that, and so we were able to get some initial. We only got a few. We got like 4 or 5 machines. And then as they obtained more and more, we were able to get more and more of those. So these actually came from our department, the State Department of Health.
Okay, great. Yeah, thanks for sharing that. And let's go back to this question of programming and education. Deidre, you spoke to this a little bit already. Wanted to get additional thoughts about we've got a lot of folks here on the webinar who work in systems, who operate facilities, who are looking for kind of creative ways to keep kids connected, whether it's virtually or figuring out safe ways to keep kids connected to the community. Generally, is there anything else that you would add? Any innovative strategies that you've been utilizing that might be useful for the attendees to hear?
Well, we went to a virtual style of learning and training. Our education is being conducted in a virtual style, as well as our volunteers. As soon as this pandemic began, our volunteers were just asking, what can we do to help our children, help the children? So they began to reach out to us and come in through virtual devices, teaching coping, still teaching the classes that they were teaching in the beginning, coping skills. Shakespeare, we have a Germantown Shakespeare production, working with the kids with Shakespeare, just coming in with life skills, still mentoring and providing religious services to them virtually. And the children are really engaged in this type of learning style, and still providing education virtually. But with the resources that we have with our program manager working with our youth, and even our staff being, working with our youth, we've been very blessed to have just the support that we have and reaction from the kids. We also run a COVID related video, informational video, educational video, so the children can kind of understand the virus and what needs to be done to stop the spread. Wearing the mask, they understand wearing the mask, because all of the youth wear masks while outside of the room, and all of the staff, of course. And so just keeping them engaged in a safe way. They're seated 6 feet apart. They really, the only difference probably that they see is wearing a mask and having to wash their hands and clean and sanitize more often. But just like it, just maintain a positive environment.
So Deidre,
keep
in here, because I think a little, so I wasn't able to. Would you mind just repeating? Deidre, are you? Okay, I have lost the conversation going. Talking a little bit about, we also know that to their and to Matt, can you talk a little at New Beginning?
Maybe while that ways where we engage something. We knew there would be situations where youth would end up, we're always balancing medical protocol versus everything we know that is the best developmental approach for youth, and sometimes those sometimes can kind of collide a little bit. So our infectious disease protocols, if you have COVID, we taught that's going to be some form of medical action and continued things like that. Early in the pandemic for us, another area we thought about, and it was definitely a learning curve, as it is for everybody, but looking at, okay, if you're going to have a youth, it's going to have to be in that type of setting, for medical reasons. What can we do to lighten the burden, as it were? And so for us, we bought iPads. We bought Nintendo Switches that the youth can use and so they can have time, so that no matter what, if a youth's on medical isolation, they either have a a DVD player, an iPad, or a Nintendo Switch, something that's portable, and that also allows them to do their video calls, have FaceTime, all that type of stuff that we're able to kind of navigate during the pandemic, which I think everybody can. It's not that we want to find ways to detain somebody while they're in confinement. We avoid confinement at all, but hopefully see that even if their situation that may be required medical necessity, still have ways and that youth engaged.
So thanks for that Brett. I am back on. I think I lost my connection for a second. I'm hoping that you all can hear me. If you can give me a thumbs up. Yes. Okay, great. So I apologize if you chatted about this while I was having connection issues. But one important dimension of our work, in addition to keeping kids engaged in programming and education, are those connections to family and connections to advocates and supporters while they're in facilities. And so I really want to turn to Mac here. Mac, I know you've done a lot of work in DC with respect to connecting kids to credible messengers and to their attorneys. Talk a little bit about your efforts to keep kids engaged to their families, to their supporters, to their advocates during this time.
Right. Thank you. So immediately, one of the first things that we did was pre-COVID, kids generally got 2 to 3 phone calls a week. And so we immediately went to daily phone calls. If the youth want to reach out and contact and have communication with their parent or guardian, they're able to do that at both facilities. In addition to that, and Brett sort of alluded to this, as well as Deidre, our juvenile justice institutional counselors, as well as like our care coordinators, would make sure that they would communicate to families and update families on everything that was going on. But we'd also provide, FaceTime visits with family members, because we understood the importance of a parent not being able to see their kids or come in for visitation and things of that nature. And so that sort of helped us, at the outset of the pandemic. One of the things that was really, I thought was really great was early on, we worked with our advocates and the Public Defender Service. We had a couple of conference calls with them early on, and they actually put together a list and provided donations of activities and books and games and things like that for all of our young people at both facilities. And so it was an opportunity for this partnership and this collaboration, and for all of us that's interested in the well-being of our young people to come together and come up with ideas on how to keep them engaged. And we really appreciated the advocates and PDS for that. And one of the other things, Michael, is that of course DC Superior Court closed down, so we had to start doing court virtually out of youth service centers. So we had to move court into youth service centers. We had to move our at-risk team, which is usually housed at the court, into our facilities. And that's been a tremendous partnership and relationship that we've been able to develop. And parents are actually able to come to the facility and go into the community room, and through a webcam, they're able to be present in the court proceedings for their child, right? In terms of credible messengers, these are individuals who have lived experience, who act as mentors, and they're embedded in our facilities at New Beginnings and youth service centers, and they're mentors, right? And they provide an extra layer of support to our youth development representatives, but they're able to engage our young people and talk to them about their journey and their experiences. And so Grow Up, Grow Out, which was one of our credible messengers provided, has been a very important partnership throughout this pandemic. And lastly, Director Lacey hosted a town hall for parents back during the summer, which allowed parents to call into a WebEx like this and ask questions and just sort of talk about the things that DYS was doing to make sure that their young person was supported and getting all the things that they needed.
Excellent. Thanks so much, Mac. And I think all of those efforts, I know that, Deidre and Brett, you've got similar stories in your jurisdictions about keeping kids connected. But we know from experience and from research that safety is better maintained when we can facilitate those connections, that engagement and education is improved. That dimension of family engagement and engagement of advocates and supporters is so important. So it's really good to hear. We're going to transition to the Q&A period in just about 5 minutes. And I wanted to make sure that we talked a little bit about the path, the trajectory that you all have been with respect to room confinement in particular, given the focus of this webinar. We know that this path, this moving from a place where you might rely on room confinement as part of your approach at the facility level to one where you don't rely on the practice can be very challenging from our experience in assisting jurisdictions through the campaign. One of the common questions that we get from facility staff who have relied on this practice over time is, well, if not this, then what, right? In other words, if we can't use room confinement for disciplinary reasons or for other reasons, then how do we maintain safety, right? What tools or supports will we have to make sure that we can keep kids safe, that we can keep staff safe? Deidre, talk a little bit about the path that you've taken in Shelby County to get where you're at, how you might have addressed some of these concerns to the extent that they existed from staff within the facilities, to let them know that there was a better path forward. Talk a little bit about that trajectory, and then I'd like to turn to Brett and Mac to talk about their experiences as well.
Well, I want to begin by saying in 2015, the Shelby County Sheriff's Office assumed responsibility for juvenile detention during a time that it was under a consent decree. We were faced with many challenges, but interestingly enough, this is what laid the foundation to new strategies, better strategies, quality and assurance, using our report card data, which was very good data to make good decisions and things of that nature. And we found that just investing in a positive behavior management system benefited us to kind of change the environment where children felt safe and they didn't reduce the need to act out as much. We found limiting room confinement, children were more engaged in programs. It was like a calmness, a quietness in the environment where children were less stressed, and even staff were less stressed. Reduction of assaults, we saw a reduction of assaults and suicide. We found all of these areas began to decrease and give us an opportunity to provide mentorship to them and create a positive and safe environment that was consistent with structure and order that made the children feel safer. And I just felt as an administrator, it was imperative for me to recognize, sometimes we don't know everything, and there's always an opportunity and room for improvement. We even went as far as got with staff and kids and got their input on developing a disciplinary matrix. And this disciplinary matrix looked for alternatives to consequences. And these suggestions came from staff, and that's how we got the input. And the one thing that this disciplinary matrix did not have was room confinement. They could come up with as many consequences that were fair and natural outside of room confinement. We restricted them from that. And that kind of set the tone and the attention toward looking for alternatives when a child acts out and one that's not harming them, not interfering with their development and things of that nature. And it actually worked out really, really well. It's one that the children agreed to, and as well as staff. So there's your buy-in. That was a big deal with us. So just looking for alternatives to this room confinement, enhancing our training with our staff and getting them involved in understanding what an effective behavior management looked like. To set up this positive environment. And in the end, the children never changed. We changed, and they responded to this environment that we created for them, and it worked out. It didn't happen overnight. It took time, it took patience, and we trusted the process. We're not perfect. We're just positive. We're not perfect. We're just positive.
I love that. Thank you so much for that. And I hope folks caught that, that the children didn't change, the staff changed and the environments changed. It's really powerful information there. I will say that some of the resources that we have in the box there, in the handouts, do speak to this notion of advancing culture change and changing your policy and practices around that. So I would encourage folks to take a look at those documents. That includes a toolkit that CJJA put together years ago, and the more recent Not in Isolation report that we at the campaign developed recently as well. Brett, let me turn to you in Utah. Talk a little bit about how you've supported the culture change process to get where you're at now.
Yeah, I think that, Michael, I think that it is so important to kind of couple those together, right? The policies and procedures, but also the cultural aspect. So it's, we have to develop the right type of framework that has, whether it's, increasing accountability or helping establish consistency. But I really feel like one of the, maybe the most critical element is that cultural aspect. And whether that comes from leadership, I think leadership down the line, recognize it looked like a will behind the way, or a will behind the why. So the why is, look, we're here to change young lives. Like, we're here to help and improve and develop so that these youth don't have to ever come back into this setting. And we're trying to, and we know that sometimes we're very deep end of when they're coming into care, and we can't unravel every, trauma or different experiences that they've encountered. But when they're with us, that's our charge and that's our focus. And so when that kind of will comes down, I guess you'd say, down the line, and it takes time to cultivate, because initially staff could say, well, why, now the kids are running the show is a phrase I've heard said, now I have no, like you said, no power. And so sometimes maybe it is baby steps, but establishing kind of those North Stars for your system, of what they are. Like, look, here's at the core. We're going to provide trauma-informed care, period. And now let's start working together. And then what's amazing, like, so for us in our journey, I think like the latest iteration of this journey is, our dosage approach, in our secure care settings. And now I'm starting to have the data of not only are kids, are they receiving the appropriate evidence-based amount of treatment? Now I have a reduction of assaults. My assaults are down 40%. And so now it's starting to become tangible, and I can show that to staff. And then I think as that wheel continues to kind of turn or spiral upwards, as I like to kind of think about, I think that staff engagement improves, quality or joy, as it were, in your job increases, because it's more meaningful. And I really do love what Deidre said, that the kids didn't change, we did. And how are we going to help them change if we're not able to, as systems, to have that kind of honest look in the mirror and know it's going to be a journey, and there's going to be tools that will help. There'll be, experts, obviously, and there'll be technological tools. There'll be all these things. There'll be policy mechanisms. But ultimately setting that out, that why of why we're doing this, I really think that goes a really, really long way.
That's excellent. So helpful, Brett, for those remarks. And Mac, let me turn to you to hear about the path that you've been on in DC.
Well, thank you. And I agree with Brett, definitely, and Deidre, but he mentioned the North Star. And that's something that Director Clinton Lacey talks about all the time, the North Star. When I came into this work, I understood that anytime a young person comes in contact with the system, that their experience should be rare, it should be fair, and it should be beneficial, right? And so that's the understanding that we want our staff to have. Now, having said that, it's still important that leadership and management have a level of understanding of the real fears and anxieties that staff have. I always tell my managers, we have to listen to what our staff is not saying. And really what they're saying is they want to be able to come into the facility and go home in the same way they came in, right? And so we want to, give mental recognition and be thoughtful about what those concerns are. So one of the things that we've done and continue to do is we try to provide an increased level of management and leadership presence enhanced trainings that provide staff with additional tools to successfully engage and build healthy relationships. We use the positive use of justice framework. Training staff in restorative justice. Director Lacey, when he came in, he brought restorative justice with him. So of our probably 500 or so staff, probably 95% of our workforce has been trained in restorative justice. But then we also have some of our direct care staff who I would consider master facilitators, and they do the prep work. Restorative justice is a voluntary process, but not only do our staff have a great understanding of restorative justice, but our youth have a great understanding of restorative justice, how to heal the harm, how they can reconcile a situation, how they can have a restorative conversation with their peer or with the staff if they've had a conflict with a staff. Understanding that juvenile justice, a youth contact should be, like I said, rare, fair, and beneficial. One of the things that we've done, and important work that we've done, has been led by Dr. Kenya Key, who leads our behavioral health work here. And all of those staff have been trained in restorative justice, trauma, and grief component therapy for adolescents. We have a behavioral health division. We have a HRT, a health and restorative team. And so there's a lot of different approaches that we've taken head on, right? Like we started a process with Dr. Kamalo a while ago where, we didn't just want to talk about what we were doing. We wanted to seriously look at and put all the pieces together to make sure that, as Brett say, that they're getting the proper dosage that they need, but we don't want to lead with safety and security anymore. A lot of facilities, the whole thing is about safety and security, right? That's a given. It's about treatment. It's about helping these young people through cognitive restructuring see themselves in an amazing way so that when they go back into the community, that they can have purpose and do things that's going to be constructive for our society. So those are some of the things that we have been doing and some of the approaches in terms of the overall culture change. We know that takes sometimes 3 to 5 years, even more. I know Deidre mentioned coming out of a consent decree. We just came out of a 35-year consent decree here in Washington, D.C. And a lot of it is attributed to us, just grabbing the bull by the horns and tackling these things that needed to be tackled so that we can make this place safe and productive for the young people that we serve.
Thanks so much, Mac. Very powerful. I see thumbs up around. I think that, from our perspective in the campaign, one thing that makes this issue so powerful is that it's bigger than just room confinement per se. It's really reflective, as you all are describing, it's reflective of a developmental approach, an approach that's more therapeutic in nature. And when we look at the research on what works with respect to juvenile justice programming, we think about the meta-analysis that Dr. Mark Lipsey conducted at Vanderbilt and his colleagues. We know that approaches that are steeped in philosophies that are therapeutic and developmental in nature are much more likely to get the outcomes that we all seek, as opposed to approaches that are steeped in control or fear or surveillance. And so safety as a fundamental dimension absolutely is the case, but it's about shaping our programs and our approaches so that we really are meeting the needs of young people and families holistically in a developmental way. And I think that each of you are speaking to that very powerfully. We've got some questions here that I want to direct to specific panelists, and forgive me for jumping around. I'm going to go as I see them. So I'm going to start with a question for Mac. Mac, we're getting folks want additional information about the Credible Messenger program that you've got in DC. I know this is an effort that's increasingly more jurisdictions are interested in it. Can you provide a little bit more details on that and how they support specifically the kids who are at YSC and New Beginnings?
Right, absolutely. So our Credible Messenger initiative, I want to say, was started about 3 years ago here in the District of Columbia. As I mentioned earlier, Credible Messengers are individuals who have shared life experience. And so most of our Credible Messengers, but not all, are individuals who spend time either in a juvenile correctional setting or in the adult system, right? And so we believe that through that shared life experience that they're able to have a level of relation and relevance to the young people that we serve by sharing their experiences, also by providing hope. We understand that no one should be defined by any one decision or choice that they make. And so we have credible messenger organizations. I believe that we have 7 that we contract with here in the District of Columbia. So not only do they engage our young people while they're in the facilities, like we have one contractor, Grow Up, Grow Out, who is embedded in the facilities, but then we have credible messengers that are in the community, right? And so as a young person prepares to be released to the community, that credible messenger has been coming to visit and engage with the young person prior to release to make that juncture of vulnerability or that re-entry process smoother. And so once they return to the community, they have their care coordinator, they have their social worker, but they also have their credible messenger that can help them sort of guide them, help them to make their appointments, help them with their educational opportunities. And so that's essentially what the credible messenger program is. It's something that I think that other jurisdictions should really look into, because that's a resource, that's an untapped resource in most jurisdictions. But DC, we're taking advantage of that lived experience with the credible messenger program.
Thanks so much, Mac. Brett, let me turn to you. We've got a question here about the DBT approach. I know that this is at the core of your programming in Utah. The question specifically was around how you train staff around DBT, who gets it, you know, how you approach it, but just talk generally about how DBT, what role DBT, and by DBT, I mean dialectical behavioral therapy for, I apologize for using that acronym without spelling it out first. But talk a little bit about what it is and how you approach it in Utah.
Yeah, so we also, you know, we ended up going with a, we have a contractor provider who helps us with the training aspect. So I can't remember the exact company we utilize that helps come in and, you know, do training. And so, but there's kind of levels of it. So we do, you know, kind of intensive clinical training for our clinicians in DBT, but then there's, you know, a less intensive kind of the skills side aspect of DBT that we have for all of our line staff, and then helping our supervisors. And then in each of our secure care facilities, we do have a program coordinator who they're there to monitor fidelity, to ensure, you know, that it's being taught and, you know, trained to the model. Most importantly, though, with our program coordinators is they, with the counselors and supervisors, is to see the demonstration of the skill. You know, that's really what is at the heart of it. So it's, you know, it's not just us teaching something, it's really, we want to see those skills demonstrated. One of my very favorite things to do, you know, and I'm obviously at the state office, I'm not out in the facilities. One of my favorite things to do is basically any facility I can go in and I just, if I'm out, if I'm talking with any of the youth, I can just say, you know, tell me your favorite DBT skill. And how do you apply that? What does it look like? And, you know, seeing them and be able to walk through, and they can, you know, they walk through them with me. Oh, this is the stop skill. This is what I do. Here's how I used it. I used it yesterday. I was in a basketball game and, you know, a guy elbowed me, and here's what I do. So that's really, like I said, that is kind of that centerpiece. And we really provide that training all the way down the line, knowing that it has to be more intensive at certain levels.
That's great, thanks. And I do want to let folks know that several jurisdictions do use DBT in their facilities, including Massachusetts. In the Not in Isolation report, again, that we've shared with you today, you'll see the Massachusetts story reflected there and how they've used DBT as part of their approach. Deidre, let me turn to you. We're getting a question here around the quality assurance process that's used to track room confinement in particular. The person asking the question is interested, how do you track the use of room confinement, and how do you use the information? Do supervisors and managers, for example, sit down with staff who perhaps have used it to talk through you know, what went right and perhaps what went wrong, opportunities to do the work better? Talk a little bit about how you monitor the data and approach the quality assurance around room confinement.
Well, our staff, our supervisors monitor the room confinement or the log sheets on the door, and we have to track the amount of time all of the youth spend in the room overall, and we kind of monitor that on our report card as well. We also have cameras where we can kind of watch, and supervisors when they do their walkthrough, they're looking in rooms to ensure, inspect what you expect. We also have a survey, safety survey that we give to staff and youth that asks questions. Are you in fear for your safety here? Is there someone that you can talk to? And things of that nature. Are you receiving your grievance forms? Are you familiar with the grievance forms? And we kind of do a survey with youth and staff just for feedback to ensure that the area, that the facility is safe. And we want to hear from staff, because like mentioned, sometimes you have staff that are afraid of some of the youth and the reactions, and they want to know how can they feel safer, and they want us to know that they don't feel safe. So it gives us an idea of the tone that's being set. So we take those surveys seriously. We review each one of them and we track them. We track our, like I say, our logs to ensure that youth are not being left in rooms, or the integrity of the process, and supervisors are involved. So we track the time to see if it's going up and down, and we set goals, you know what I'm saying, to make sure even if we have to place a youth in a timeout, those numbers, if they're going up or down, and how they're being used, and what's the timeout in the room or in the area. And we talk to staff, just communicate to them about trauma and the effects of being in the room. We just keep communicating with them and making sure that they're doing what they need to remain safe. We just hold staff accountable. We monitor them, but we also support staff, because at the end of the day, it's our goal to make youth feel safe. And we often tell staff, when youth feel safe, they tend to act out less. So we continue to monitor the entire process, and the documents are inspected and reviewed, and this information is entered on a report card that we have monthly, and we have a monthly meeting where we discuss these areas that we need to address, and we talk about also the wins, the gains, and let staff know that they're doing well. So that's the reinforcement for them as well. So just tracking the data that way helps us.
It's such an important point, Deidre, that we focus not just on opportunities to do the work better, but actually, catching staff in the process of doing things right as well, and really celebrating those strengths in that way. Mac, let me turn to you. I've got a question here about, is it possible to truly facilitate programming when you've got active cases of COVID in the building, whether with staff or kids? How would you respond to that, Mac?
Yeah, so it's definitely possible, like once we've been able to get past, if we have a spike, of course we follow all the necessary protocols and the guidance by our chief medical director and, the Department of Health and things like that. But we still find ways, we modify, we do what we have to do to make sure that we can still keep young people engaged at a level that's safe for everybody. And so if you're a facility or a jurisdiction where, you're dealing with a spike currently, then of course, you have to address the safety concerns and the issues first. But I would say, just as an example, when the pandemic first hit, of course, we had to get educated on everything, right? And so there was a period of time where, vendors weren't in the facility, so on and so forth. But I would say probably by the end of April, we had figured out a way. We had enough meetings, we had collaborated, and we was able to modify our programming and do it in a safe way. And we went probably from April until November, December before we saw any type of spikes at either of our facilities. And so, we just continue to follow the guidance that's provided for us, the guidance that's provided by our chief medical director, so that whatever we do, we're doing it in the safest manner.
That's great. And let me follow up, because I see that we've got several questions about the testing procedures around COVID. And Brett, let me turn to you for this one. We're getting questions around what's the frequency by which we're testing kids for COVID? Where does it take place? Kind of some of the details of the testing part of that. Can you talk a little bit about how you're approaching that in Utah?
I can. So, like I said, so every youth that comes in for intake, into detention, they all are tested, kind of automatically. Any transfer that would occur, they would be tested. We also, too, if we have a youth who's, maybe they appear symptomatic in any way, well, then we can administer a test right then as well. These are all done within our facilities. These are all done, so with our rapid machines. If let's say I had a unit and one youth tested positive, and then we would test everybody in that unit. And if any of the ones that came back negative, we would also send those off to a lab as well, just to have kind of that extra layer of making sure. And now, luckily, even if we're sending out to the lab, we're still getting pretty darn quick responses. And so we have, we haven't had a lot of situations where we've just had mass testing. We have done that. We have had, we had a facility in the Salt Lake area where, we basically decided we were going to test everybody. We were going to test all our youth, and if there's a reason to believe that staff were exposed at work to COVID, we can also administer a test for them as well. But it's definitely been like this, constant balance of, now the supply side of it is less acute, as it were. That was always the big challenge. And then it's just kind of navigating, like, okay, when are you going to roll it out, broader? Am I going to go test this whole unit, or am I just testing, these symptomatic youth? But that's kind of how we've taken them on and evaluated these things. Again, also always, having that consultation and guidance from our medical partners.
Great. So I do want to transition to our closing question for today, reserving some time for our exciting announcement as well regarding this body of work. So let's do that. There are, as I mentioned, we know that there are jurisdictions and facilities all across the country that are really interested in this issue and in moving towards the elimination or the reduction of the use of room confinement in their facilities. I'd like each of you just to share your top piece of advice, right? This has been a long path that you've been on. There's obviously more work to be done. The pandemic presents even more challenges in this respect. What's your top piece of advice for other leaders in jurisdictions who are interested in moving in this direction? What would you advise them to do? Mac, I'll start with you, and then Deidre and Brett. Matt?
Certainly. So what I would say, and I'm talking to, all the jurisdictions throughout the country, all of the leadership throughout the country, we cannot equivocate about room confinement. We need to agree that solitary confinement, that isolation, that confinement for kids is just not the right thing to do. It's just bad. We just need to all agree on that. And basically have a plan. We must do what's necessary and what's in the best interest of our youth. One of the things in change management, they talk about plan, do, study, act. So if you're considering it, if you're thinking about it, if you're looking at doing a culture change and a culture shift, then just plan that change, right? Do it, study it, and then the data and the information that you get back from that, use that to help guide you. It's nothing that's going to happen overnight. There's going to be pushback, there's going to be anxiety and fears, but I would definitely encourage you to start walking in the direction of the North Star and develop the North Star for your organization and your agency.
Thanks so much. Deidre?
I agree with you, Mac. As an administrator, we should set the tone. This is unhealthy. This is unsafe for youth. It's cruel and inhumane, and we have to set the tone. When you get ready to go into the direction for this change, hold staff accountable to follow the directives, period. It's about the kids. This is our profession, and our profession includes keeping youth safe. Communicate with your staff. Go and, well, we can't right now, but observe other facilities, network with other facilities that have been successful in this area, and get all the resources that you can as an administrator and your team to present it to your staff, to engage them in this new, in this process. There are a lot of resources is available out there and information on how to create an environment that's safe and without room confinement. And it's like Max said, these are children, human beings, and we have to approach them that way. You want them to leave your facility better than they were when they arrived. And we have an opportunity to do that, to make their lives better when they're in our care. And it's our responsibility, it's our job, and hold everybody accountable to do it on your team. So I agree with Mac. This is something that needs to go away. No excuses. There are alternatives, and let's just get it done. Thank you.
Thanks so much, Deidre. Brett?
So I think that, you know, I absolutely echo what Deidre and Max said in the sense of take that plunge, but also just recognizing that plunge or that step, you know, it's grounded in research and it's grounded in data that'll demonstrate that you'll have, the data's there and the research is there. It'll demonstrate and fulfill better outcomes for the youth, which in turn creates better outcomes for the public. You know, that's the whole point, right? That's what we're doing. And so I think from that perspective, knowing that there is that real strong backing and acknowledging that, then I would say too, with, I know this is a broad and varied audience, provide forums for voice, you know, with your staff, with the youth, in every level. And that's something that, you know I can improve on in my system. We try to accomplish that in different ways, but helping, and then again too, being able to share kind of that lived experience. You know, Mac talked about credible messengers. Well, you know, my experience is that peer approach to learning, that works across the board. It doesn't work just for kids. And so, you know, you're going to get those early adapters, as they always say. You're going to get those people who are very much philosophically aligned with, no, we want to serve these kids in a different way. Well, then help them be your champions. Create ways and forums where they can share and be that, as it were, credible messenger or peer voice for their fellows, where they're saying, no, look, here's how we're doing it and here's what we're seeing. And then, you know, then that cycle starts. And it is a long, slow process, as with any change in these systems. We took how many decades to build it this way? You know, how many decades? But what I can say, and I know that, you know, I think all of us are seeing this and are along for the ride in juvenile justice, but it can change real quick in a good way. You know, just number of years and you can see dramatic change. So it's worth it. It's the right reason. It's the right why. And then even if that stuff, if you're putting that aside, it's the right why from the perspective of, you know, what's the taxpayer return? What's the, you know, what's going to give you that, what's going to keep the community safer? All of those things. It stacks up, it lines up the right way.
Wonderful, very well said. On behalf of the Stop Solitary for Kids campaign, I want to thank you each, Mac, Deidre, and Brett, for speaking with us today. We know these are extraordinarily challenging times, and we just want to thank you for your leadership as you and your staff work to keep young people and families safe and supported and healthy throughout this pandemic. We also want to thank our webinar attendees today. Whether you work within systems and facilities or you work to advocate for and support young people and families, thank you for all that you do as well and for being with us. As I mentioned at the outset, we and our partners at CCLP, JPI, and CJJA really are proud to continue our work with the Stop Solitary for Kids campaign, continuing to build awareness about these issues and support for approaching the work without relying on solitary confinement and isolation. And to this end, as I've mentioned, we have a very exciting announcement to make today, which is that with the generous support of Arnold Ventures, we and our partners at the campaign will be leading a series of new activities and opportunities for the field in 2021 and beyond. We're just so thrilled to be able to offer these resources and opportunities. This includes new training and technical assistance opportunities for jurisdictions and facilities that are interested in moving away from the use of isolation, including targeted support around the use of our room confinement assessment tool, or RCAT, which communities can use to track, assess, and provide strategies to reduce the use of isolation. It will also include the launch of a brand new certificate program that we'll be hosting in Washington, D.C., focused on the elimination of solitary. Up to 5 teams will be selected for this incredible training opportunity. And after participating in the program in the fall, teams will receive ongoing TA to lead reform efforts in their own jurisdictions around eliminating solitary. This body of work will also include supporting leaders to conduct site visits to other jurisdictions that have successfully reduced room confinement, so that leaders can learn directly from their peers and colleagues. We know that's very powerful. In addition to providing training in TA, we at the campaign will also be working to build the body of knowledge around how young people experience isolation and room confinement nationally. This includes new data collection and analyses around how youth of color experience this practice, with the goal of lifting up strategies to reduce those racial and ethnic disparities faced by youth of color in custody. Our body of work here will also include targeted efforts really to elevate the voices of young people, of families, and individuals with lived experience. And finally, for our budding lawyers on the webinar, we'll also be developing a new dynamic law school curriculum on the topic based on the Khalif Browder story, the documentary that demonstrated the life of Khalif Browder and the harmful impact of solitary confinement. As you can imagine, we're excited about this development. We're so grateful to Arnold Ventures for the support. We'll be providing more information about all of these activities in a press release and on our website. For those of you who may be interested in working with us, please be sure to connect, to sign up, to contact our campaign manager, Jenny Lutz at CCLP, and we can go from there. So with that, we've reached the conclusion of our webinar today. I want to thank you all again for being with us. I hope you all continue to stay safe and healthy in 2021. Take care and be well, and we will see you soon.